Okay, this video is to introduce my new book. It's called Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. Okay, and on the cover of the book is the crucifixion painting of Carl Bloch of Christ. And right here on the inner leaflet is a crucifixion painting of Christ. And what you're seeing here is the spear of Longinus going into the side of Christ. And the painting is by Gaudenzio Ferrari from 1513. As the spear of Longinus goes into the side of Christ, another angel collected the blood in the Holy Grail. And the gist of that is that the Holy Grail can heal anything. Okay, so it's the magic thing for healing. And these are the 5 wounds of Christ. The wound in the foot, the wound in the hands, and the wound in the side. Those are the 5 wounds of Christ. Okay. Now, the reason I show you that is just to establish the baseline. The book was just published this month. Okay, here's the lower part of the painting. Okay, and this painting here is the 5 wounds of the village idiot. So the village idiot went for coronary artery bypass graft surgery. And that's also open heart surgery, of the coronary arteries for atherosclerosis, chronic angina, typical indication. And there's 5 wounds. There's the wound in the groin for the cardiac cath with a sheath going into the common femoral artery, common femoral vein. Okay, there's a mediastinal tube, and there's a left chest tube. There's a sternotomy, rotating circular buzzsaw through the sternum, crack the chest, spread it to sternum, access to the heart, the coronaries due to bypass. There's a right internal jugular vein wound for the sheath, put in a Swan-Ganz catheter, pulmonary artery pressure catheter. Okay, and why do I say these are the 5 wounds of the village idiot? Because you got much better results with a low-fat vegan diet for treatment of chronic coronary angina than you do with open heart surgery. This doesn't significantly increase longevity at all. And there's potential for major complications, including stroke, including hypotensive cognitive impairment, thromboemboli from the pump, post-operative hypotension, cognitive impairment. So, why would anybody go through all that when you got a better option available that's free? Okay? And there's also a lot of money to pay. The price for open heart surgery is in the ballpark for around $200,000 if you include all the fees, operating room time, ICU time, etc. For coronary artery stents, it's about $40,000. When smart people, all you got to do is go low-fat vegan with no oil, and it's free. Okay, and then I want to answer another question, because some people will say to you, why am I writing a book about how to prevent and reverse stroke and heart attack when Dr. Caldwell Esselstyn already wrote a book? Caldwell Esselstyn wrote a book about how to prevent heart disease, and his book is magnificent. Okay, Caldwell Esselstyn deserves a Nobel Prize for reversing coronary heart disease. That is a magnificent achievement, the #1 cause of death in the Western world, and he figured out how to cure it. That's fantastic. A lot of others did great work leading to that. Of course, the great work of Walter Kempner, the great work of Nathan Pritikin, Dr. McDougall, as well as, of course, Dean Ornish, who also did a randomized controls trial with a plant-based diet. Okay? But I felt that there was a benefit to writing a more detailed book. Esselstyn's book was written for the lay public. He basically says, if you eat the low-fat vegan diet, you'll maintain your arterial lining, endothelial nitric oxide, and that's all you need to do, and you'll keep your arteries open. And it's actually pretty much true, but I think there's people who want more information than that. Inquiring minds want to know more detail about how it all works, and mine went into way more detail. So basically, he wrote his book essentially for the public. My book is written more for, for doctors or for people who want a more detailed, sophisticated, nuanced understanding of atherosclerosis. And also I go into a lot of information about, what caused the stroke, what's same or what's different with a stroke versus a heart attack. I also think Esselstyn screwed up by going along the flax thing. He doesn't know nutrition in that much detail. He's a little bit of a one-trick pony. And he sort of went in for, let himself get peer pressured into flax. The only thing I ever heard him say about it was, it's good for fiber, good for omega-3, but those are bogus reasons because you can easily get your fiber from other sources and you don't need it for omega-3. You get plenty of omega-3s for other reasons, so why eat such a high-fat food with cyanogenic glycosides, etc.? Okay, so anyways, the book here, I'll just show you what it looks like. It's about 170 pages, like my typical books. Lots of drawings in it. I always put lots of drawings. I go through the history of the disease, who are the pioneers that figured it out, what you need to do to prevent the risk factors, how do you prevent hypertension, a little bit about how you prevent diabetes, what causes blood to clot, what makes your blood prothrombotic, stuff like leaky gut leading to amyloid clotting, iron overload leading to ferrous redox cycling and amyloid clotting, how that affects coronary artery disease, atrial fibrillation, congestive heart failure, things like that. I go through stroke, a little bit on the concept of excitotoxicity, not that much. My other book, Food, Mood, and IQ, goes into way more detail. I do go through, the picture of, let's see here, of, vascular hypotension, overtreatment of hypertension as a cause of cognitive decline. And, a little more about the detail of the different types of strokes, from hypertension, from atherosclerosis, and from atrial fibrillation, and from diabetes. So anyways, if you want to understand heart attack and stroke better, the book will be helpful to you. And I also think it strengthens a person's resolve. If you're good to go with, hey, this helps maintain nitric oxide, that's great. And Esselstyn had tremendous compliance with his patients and fantastic outcomes. Okay, but for some people, they just like to understand more and more detail. And there is more detail there. And it all supports the low-fat, low-sodium vegan diet with no oil, single-ingredient foods only, 100% organic, okay, whole foods. So anyways, hope you found that helpful.